In a world where the development of the human mind is fast becoming the preoccupation of forward-thinking nations, and where emphasis is shifting away from natural resources to human-based endowments, the wellness of the human brain continues to come under increasing scrutiny. Many countries are rapidly waking up to the reality that mental health, within the context of a functional healthcare system, should be a major consideration for policymakers and implementers. This is needed in order to stay abreast of the emerging cutthroat pace of global competition with limited resources.
That's right. But as important as mental health has become in the global scheme of things, the stark reality remains that many people do not still understand the fundamental recommendations for keeping sane. Economic and peer pressures are having a more than negative impact on global efforts at tackling the challenges of mental health. Unpredictable phenomena such as pandemics and wars are also playing their parts. The good thing, however, is that after all is said and done, conversations about mental health is at the moment being treated with greater urgency more than ever before.
We shall pause at this point to take a look at a special package on mental health, put together by a hardworking producer, Ikenna Kingsley. We'll be right back.
One of the most neglected areas of health globally that people hardly acknowledge is mental health. There are several reasons why mental health has been ignored, and top among them is the stigma associated with it. Some other reasons include the poor provision of mental health services, mainly in psychiatric hospitals, a severe lack of preventive mental health service, lagging policy changes, and growing shortage of human resources. In the past, people hardly spoke about their mental health, mainly because of perception of it as weakness, especially in men. Such perception has over time given rise to the expressions like "man up" and "be a man," which gives people the impression that mental health disorder is a sign of weakness. Today, nearly 1 billion people live with mental conditions, and in low-income countries, more than 75% of affected people receive little or no medical care. In recent years, there has been increasing acknowledgement of the important role mental health plays in achieving global development goals, as illustrated by the inclusion of mental health in the Sustainable Development Goals. Depression is one of the leading causes of disability, while suicide is the fourth leading cause of death among 15 to 29-year-olds. Despite progress in some countries, people with mental health conditions often experience severe human rights violations, discrimination, and stigma. Throughout our lives, multiple individual, social, and structural determinants may combine to protect or undermine our mental health. Individual psychological and biological factors such as emotional skills, substance use, and genetics can make people more vulnerable to mental health problems. Exposure to unfavorable social, economic, geopolitical, and environmental circumstances such as poverty, violence, inequality, and environmental deprivation also increase people's risk of experiencing mental health conditions. Risks can manifest themselves at all stages of life, but those that occur during developmentally sensitive periods, especially early childhood, are particularly detrimental. For example, harsh parenting and physical punishment is known to undermine child health, and bullying is a leading risk factor for mental health conditions.
Immunity is waning to a plan for boosters.
According to the World Health Organization, the COVID-19 pandemic has disrupted or in some cases halted critical mental health services in 93% of countries worldwide. All the demand for mental health is increasing. Given the chronic nature of the disease, this translates into a significant economic impact worldwide. Countries spend less than 2% of their health budgets on mental health. It is expected that in the next 10 years, depression will put more burden on nations than any other disease.
The Center for PTSD is important to members of the armed forces and beyond, because soldiers are its are its primary victims, affecting their relationships and with colleagues, friends, and loved ones, as well as work and productivity. This center is timely, as it is a problem that really deserves a solution of this nature, and providing facilities and services for testing, treatment, and rehabilitation of patients is key. Therefore, fundraising is not a solution. The solution is the federal government that send them to fight that send them to the war front to take responsibility in taking care of their families and also taking care of their mental health after returning from the war front.
Here in Nigeria, the disparity between available healthcare services and need for mental health services is palpable. Although the country has made significant advances on challenging public health problems, health-related policy development, and legislation in trying to achieve health for all policy, there have been challenges with regards to mental health services, including that of policy development and legislation, financing, research, training, and integration of mental health care into primary health care. As we look for ways to end the stigma relating to mental disorder in Nigeria and the world, how can we further enlighten the general public? And what does the government need to do differently to cater to people with this problem? Ikenna Kingsley, Arise News.
Before that short break, we saw a great report on mental health, which captured everything ranging from the denial and stigma to the culture around mental health. This seems to be a direct and automatic result of societal expectations as well as inadequate support systems, especially at government level, where money continues to be an issue.
And that brings us to our first guest on the program, Dr. Olusegun Shoyombo, who is a consultant psychiatrist at National Hospital, Abuja. Great to have you here, Dr. Shoyombo.
Great to have you here,
Welcome.
Dr. Shoyombo. Welcome.
Good morning.
Thank you. Perspectives.
Good morning. Thank you for having me.
Thank you for we also thank you for being with us today. Recently, the First Lady Aisha Buhari spoke about her husband's PTSD, post-traumatic stress disorder, after several setbacks in his life, and how she learns to manage it from the early years of their marriage. What are the pertinent steps advised to deal with a victim of mental illness, and how can loved ones best approach and address this illness?
Thank you. I think for me the most important advice would be first for a person to acknowledge that they are having difficulties. In our environment, this is not something that people easily admit to. From the story of the First Lady, you would realize that it was a peculiar challenge for somebody in the military then to acknowledge having a mental health condition. And as it was then, so it is now. You have a lot of people who are facing difficulties, but then they have to deal with the issue of, oh, if they know at work, will they let me stay on my job? If my husband knows, will he divorce me or my wife? Or if my fiancé knows, will he break up with me? And things like that. So everybody deals with that stigma. So the very first step is to acknowledge that there's been a change. And when we talk about mental illnesses, we're talking about a broad range of illnesses. So all the symptoms are not the same. So I'm not going to come on television and say if you feel like this or you feel like that, because we're talking about a very broad range of illnesses. But when people know that they're beginning to struggle emotionally, when they know that there's something is just not quite right with them, at the minimum, they should seek help, acknowledge the problem, and seek help from professionals.
I agree, Dr. Shoyombo. We recently had the World Mental Health Awareness Day on October 10th. Can you tell us some of the activities that the National Health Hospital facilitated or participated to create more awareness on mental health illnesses?
Well, rather, I will talk about what was done at the level of the Association of Psychiatrists in Nigeria, because we came together as a group and agreed to have various activities across the country. The World Mental Health Day, of course, is 10th of October of every year. This year it fell on a Monday, and which was a public holiday here because of the Eid al-Maulud celebration. And in the week leading to the World Mental Health Day, the president of the Association of Psychiatrists in Nigeria, Professor Taiwo Bindo, was on several media houses creating awareness about the World Mental Health Day. And then the APN, in collaboration with different centers, had varying activities. The focus for us this year, of course, the theme of the World Mental Health Day for 2022 is make mental health a priority for all. And for us at the APN, the focus was on advocating for the passage of the mental health bill, for it to be signed into law, because everything that we are talking about needs to function within an enabling law. The law has to be enacted. When we are talking about a lack of financing, that is something that can be taken care of. For example, the president just signed into law the National Health Insurance Act, okay, with a repeal of the NHIS and then the institution of the NHIA, and that is supposed to take care of universal health coverage for Nigerians. And the same would apply to mental health. When you have the mental health bill signed into law, it will take care of things like human rights abuses, it will take care of funding, it will take care of human resource development, it will take care of the number of facilities we have, and all the shortcomings that you highlighted in your intro documentary. So for us, the focus this year has been on advocating for we think that the greatest gift President Buhari can bequeath to this country at this time is to sign the mental health bill into law, because as you know, if this administration winds down and a new one comes in, then all of that legislative process has to begin afresh, and we think that is unfair. And to put that into perspective is to realize that the current enabling law, the current law, I can't even call it enabling, that we have in Nigeria is the Pre-Independence 1958 Lunacy Act. Even from the name, you know that that's not the kind of law that we should. I mean, how can you have a law of 1958 guiding the practice of mental health here in 2022?
Okay. Nigeria has a significant number of people with mental health challenges. From the video we just saw, it says about 20% of Nigerians suffer from one mental health challenge or the other. And unfortunately, this is the most neglected area in the health sector. So what kind of laws do you feel should be put in place to draw attention to this and give it the seriousness that it deserves?
Well, giving it the attention that it deserves, well, the law will play an important role, but I think that as an organization, you are playing an important role by bringing this to your program on perspectives. And I think that the media can help a great deal by drawing awareness to issues of mental health, and in particular to fight stigma. We should always remember that together we fought the stigma associated with HIV. And more or less we've overcome that stigma, and we can do the same thing for mental health. And the media played a very important role. And like we like to say always, mental health is everybody's business. I think if we realize that it is everybody's business, everybody will take it seriously. I'll give you an example. If we were in a meeting and somebody had malaria and starts feeling feverish, the person would quietly excuse himself out of the hall. But if somebody has a severe mental illness in that gathering, stands up, breaks a television, breaks glass, breaks this and that, I think the meeting would come to an end, at least temporarily. And then that person will not take himself to hospital. Maybe like 4 or 5 of us will excuse ourselves from that meeting to take him to hospital. If you also consider that mental illnesses usually require prolonged treatment, it can also have people out of work or not able to function in their usual state for long periods. Then you realize that it is everybody's business. Because when your colleague at work misses work because of a mental illness for several weeks, then you may be doing a double share of the work. So indeed, it is everybody's business. We have to keep drawing attention to it. Again, apart from the World Mental Health Day, there are several others designated celebrations. We have World Bipolar Day, we have suicide awareness, and all other campaigns. And it's for all stakeholders to come together and create the right kind of attention so that people can identify these illnesses when they have them, and they know where to seek help. The crux of the documentary that you showed at the beginning of this program shows that a lot of people do not know where to get proper help, and they tend to go to those places where human rights are abused, and then people do not get any evidence-based care.
Another question that I want to ask is that I realize that a lot of people who actually are on some form of medication or the other try to wean themselves off it, because some say it makes them lethargic, some say it makes them overexcited. It just doesn't make them feel like themselves. So do you advise that it's something that you have to take for a long time, just like how you take high blood pressure tablets? Because I've had instances of at least 2 people I know that when they stopped taking their drugs, it had adverse effects on them. And most times they decide themselves that they want to stop without seeking the doctor's consent. So is this something that if you're on medication, you're going to take for the rest of your life? I'm curious about that.
Thank you very much for that question. Like I said earlier, when we talk about mental illnesses, we're talking about a broad range of illnesses. And then we cannot say that, oh, once you have a mental health condition, you take medications for the rest of your life. It will depend on what the diagnosis is, and it will depend on how a patient responds to treatment. When somebody has malaria and goes to hospital, you are asked to take medications usually for about 3 days, and then you stop. Nobody asks you to take anti-malaria continuously. But if a person has hypertension, which you've also cited as an example, the person will be told to continue to take their medications. Mental health conditions oftentimes require people to take medications for long periods. So for some patients, unfortunately, they have to take medications for life. Now, medications have side effects, and all medications, not just medications used to treat mental illnesses, have side effects. All medications have side effects, but the vast majority of people who take medications will not have serious side effects to those medications. So my advice is that people should not suddenly stop taking the medications prescribed by their psychiatrist. They should seek the advice of their psychiatrist. If they have any side effect, discuss it with your doctor. Our job, the medication is not punishment. We are seeking to make a person better. And if our drug has side effects, there are alternatives. We can change the medication, or we can reduce the dose. We can add another medication.
Thank you.
All these side effects can be taken care of.
Thank you, Dr. Shoyombo. Let's talk preventative as a final question. According to the United Nations Health Agency, Africa has the world's highest death by suicide rate, of which approximately 50% of suicides are linked to mental illnesses. Several studies over the years have sought to identify links between mental health and global technology advancements, ranging from agricultural technology to mobile smartphones. Some of the negative impacts include toxic nutrition and smartphone addiction, which has been said to increase depression, anxiety, and mental laziness. What would you say are your top 5 tips that you give to our audience today, that you tend to give to your clients to protect against mental health decline?
Well, importantly, you mentioned suicide in this brief report. And one of the ways we can prevent suicide, and I'm happy that I'm talking to you, the media, and the general public, is what we call a responsible reportage. There is a responsible way to report self-inflicted deaths, and then there's an irresponsible way to do it. When we do it the right way, we would have passed the information across, and we'll let people who need help know where to seek help. When we do it the not so responsible way, what will happen is that there will be copycats. People will go and replicate that kind of event and try to do it also. People have been having the thoughts. Of course, there are other ways to prevent mental illnesses. One of the top points I like to tell people is that for you to be in great mental health, you need to be in good physical health. So take care of your physical health. Eat well, sleep well, exercise. Number 3, avoid psychoactive substance use. Alcohol, cannabis, other psychoactive drug use, they have a way of messing with one's mental health. So people should stay away from those things. Number 4 is to realize that in Nigeria, election is around the corner. Like they say, if you cannot take the heat, get out of the kitchen. If you are going to get too emotional, if you are going to get weighed down by the activities, take yourself away. Don't listen to news 24/7. Have breaks. You know, don't bombard yourself consistently with these things. And the last thing I will say, if you feel different, you have difficulty sleeping, you have strange experiences like hearing voices, you have thoughts of self-harm, talk to a doctor.
Very well said, Dr. Shoyombo. Thank you for those excellent 5 tips.
Thank you so much, Dr. Shoyombo.
Thank you
for being with us.